Today I will be discussing with you hypothyroidism. Key points of my presentation are hormone involvement of the endocrine system from the hypothalamus to the pituitary gland, then to the thyroid gland. I will differentiate and discuss primary and secondary disorder, and then give you examples of how a patient would clinically present to you in your office. Let's learn a little bit about the thyroid. The thyroid gland is located on the front part of the neck below the thyroid cartilage. The gland produces thyroid hormones, which regulate body metabolism. Thyroid hormones are important in regulating body energy, the body's use of other hormones and vitamins, and the growth and maturation of body tissues. Thyroid hormones stimulate diverse metabolic activities, leading to an increase in basal metabolic rate. Thyroid hormones also have been demonstrated as necessary for normal growth in children, as evidenced by growth retardation observed in thyroid deficiency. Thyroid hormones have an effect on the cardiovascular system. They increase heart rate, cardiac contractility, and cardiac output. They also promote vasodilation, which leads to enhanced blood flow to many organs. It also has an effect on the central nervous system. Both increased and decreased concentrations of thyroid hormones lead to alterations in mental state. If you have too little thyroid hormone, the individual will tend to feel mentally sluggish, while too much induces anxiety and nervousness, so there needs to be a balance between the two. It has an effect on the reproductive system as well. Normal reproductive behavior and physiology is dependent on having essentially normal levels of thyroid hormone. Hypothyroidism, in particular, is commonly associated with infertility. This is an overview of the thyroid system. It starts with the hypothalamus, which secretes TRH, or thyrotropin-releasing hormone, to the anterior pituitary. It stimulates the anterior pituitary to release TSH, or thyroid-stimulating hormone, which acts on the thyroid gland. On the thyroid gland, it causes the thyroid to secrete T4 and T3, the thyroid hormones. These hormones go throughout the body to increase metabolism, growth and development, and the catecholamine effect. When the body has had enough thyroid hormone in the blood, T4 feeds back to the hypothalamus and pituitary and causes a decrease in secretion of TRH and TSH since the thyroid hormone is no longer needed. This pattern is called negative feedback. One of the most important features of the endocrine system is its regulation by negative feedback. This means that the glands within the endocrine system that stimulate the release of a hormone, like the pituitary, from another gland, like the thyroid, are eventually shut off, in a sense, so that too much hormone is not produced and the hormone imbalance is avoided. Hypothyroidism can be caused by a problem with the thyroid itself, or by malfunction of the thyroid gland or hypothalamus. In primary hypothyroidism, the thyroid can't produce the amount of hormones that the pituitary is asking it to. So in these patients, you will see elevated levels of TSH and low levels of serum-free T4 since the problem is with the thyroid gland and it is not responding to the pituitary stimulation. There are also subclinical patients in primary hypothyroidism that have mildly elevated TSH levels with low to normal levels of T4. In secondary hypothyroidism, the thyroid isn't being stimulated because there is an issue with the pituitary producing the hormones. So in secondary hypothyroidism, the TSH is low as well as the serum-free T4 low. As practitioners, we should be aware of who to screen for hypothyroidism. This includes women over 50, women that are pregnant, those that have had positive family history, a previous postpartum thyroid dysfunction, a positive thyroid peroxidase antibody, those that have had a previous thyroid disease or surgery, patients that have come from areas of endemic iodine deficiency, or premature infants that have a very low birth weight. In hypothyroidism, there are symptoms such as bradycardia, decreased heart rate, constipation, intolerance to cold, weight loss, memory problems, coarse, dry hair, slow speech and movements, slow walking movements, dry skin, brittle nails, weight gain, fatigue, irritability, infertility, a puffy face, loss of hair, and heavy menstrual periods. Other signs of hypothyroidism include decreased appetite, muscle pain, joint pain, weakness in extremities. Your patient may present to you and be depressed or have mental impairment. They may feel forgetful or have an inability to concentrate. You may find they complain of decreased perspiration. You may find on physical exam paresthesia and nerve entrapment syndromes. They may complain of blurred vision or decreased hearing. They may experience fullness in the throat or hoarseness. So you can assess your patient and their thyroid function by asking several questions. Ask your patient about any temperature intolerance or sweating. Open-ended questions include, do you prefer hot or cold weather? Do you dress more warmly or less warmly than other people? What about blankets? Do you use more or fewer than others at home? Have you noticed any new palpitations or changes in weight? As a side note, realize that as patients grow older, they sweat less and have less tolerance for cold and prefer warmer environments. On physical examination of a patient with hypothyroidism, you may notice that their skin tends to be dry and cold and sometimes more pale than yellow. Their face may be puffy as long as their hands, and as said before, they may have a hoarse or husky voice and slow reflexes. You will see cardiovascular signs based on the fact that thyroid hormones have an influence on the cardiovascular system. So you will find impaired ventricular contraction and a slow heart rate, which also results in diminished cardiac output. If you did an ECG, you would reveal low voltage of QRS complexes and P and T waves. You may also find that their total and LDL cholesterol may be increased. On pulmonary examination, you may notice shallow, slow respirations and impaired ventilatory response. You may notice peristalsis with constipation on a GI exam. You may notice decreased GFR rate and impaired ability to excrete a water load, and anemia in your patient from impaired hemoglobin synthesis, since thyroid hormones are involved with erythropoietin. You may notice iron deficiency from increased loss from menorrhagia and pernicious anemia. As discussed before, your patient may have muscle cramps, paresthesias, and muscle weakness. The thyroid has an influence on your central nervous system, so in hypothyroidism, patients will be fatigued, lethargic, or have an inability to concentrate. The thyroid hormone also has a big influence on the reproductive system, which will impair estrogen precursors to estrogens, which will alter the FSH and LH secretion, resulting in infertility and abnormal cycles. I hope this presentation educated you, and now you will be able to screen and diagnose your patients that have hypothyroidism.